Every morning, in millions of homes around the world, the same small ritual repeats itself. A glass of water. A pill bottle with a cheerful label promising vitality, strength, sharper memory, stronger bones. An elderly hand, sometimes a little unsteady, twists off the cap. And down it goes, a tiny tablet that feels less like medicine and more like a quiet act of hope. For decades, multivitamins have been sold as insurance. A safety net. The comforting idea that even if your diet isn't perfect, this little pill will fill in the gaps. And for seniors especially, that promise feels even more important, because aging bodies absorb nutrients differently, appetites shrink, and the fear of not getting enough grows louder with every passing year. But here's the question almost no one stops to ask. What happens when the body that's supposed to receive these vitamins is no longer the same body it was at 30? Because aging doesn't just slow you down. It rewires you, quietly, internally, cell by cell. The kidneys filter less efficiently. The liver processes substances at a different pace. Stomach acid, the very thing that helps absorb nutrients like B12, often declines. And many seniors are already taking multiple prescription medications for blood pressure, diabetes, or heart conditions. Multivitamins don't enter this picture alone, they enter a complex, sensitive chemical environment. This is where the story gets unsettling. Doctors and researchers have begun raising a concern that feels almost paradoxical. A pill marketed as, for your health, can, in the wrong dose or the wrong combination, become a quiet threat. Not in a dramatic, instant way, but slowly, accumulating like sediment at the bottom of a river. Take vitamin A, for instance. In excess, it doesn't just sit harmlessly in the body. It can build up in the liver over time, and in seniors, whose liver function may already be declining, that buildup can contribute to toxicity, symptoms as vague as fatigue, nausea, or joint pain that are easy to dismiss as just getting older. Then there's iron. Many senior multivitamins still include it, despite the fact that most older adults, especially men and postmenopausal women, don't need extra iron at all. Without a diagnosed deficiency, excess iron doesn't get used. It accumulates. And mounting research has linked excess stored iron to oxidative stress, the kind of cellular damage associated with heart disease and even cognitive decline. This is the cruel irony the experts keep pointing to. The very vitamins taken in hope of protecting long-term health may, in some cases, be quietly working against it. And it doesn't stop there. Calcium, long praised as the bone protector, has come under scrutiny too. Some studies suggest that high-dose calcium supplementation, without adequate vitamin D or proper medical guidance, may be associated with increased cardiovascular risk in older adults. Not because calcium is bad, but because more is not always better. The body has thresholds. Cross them, and protection turns into pressure. This isn't about fear. It's about something far more human, the danger of assuming that because something is sold over the counter, it must be harmless in any amount. We don't think twice before doubling a dose, just to be safe. We don't always tell our doctor we're taking a multivitamin, because, surely, it's just a vitamin, right? But for an aging body, walking a more delicate biological tightrope than it once did, just a vitamin can sometimes mean something else entirely. So what do the experts actually say? Not the marketing on the bottle, the real science, the kind published in medical journals, debated in geriatric clinics, and discussed quietly between doctors who watch this play out in real patients, year after year. The first thing they emphasize is this: multivitamins were never designed with precision in mind. Most are formulated for a general adult population, a vague, broad category that doesn't account for the dramatic shifts happening inside an aging body. A 78-year-old woman with osteoporosis and a 65-year-old man with high blood pressure are not the same biological landscape. Yet they might be handed the exact same bottle, with the exact same dosages, off the same pharmacy shelf. Geriatric specialists describe this as one of the quiet blind spots in everyday healthcare. Multivitamins fall into a strange gray zone, not quite food, not quite medicine, so they often escape the kind of scrutiny a prescription drug would receive. No one asks, how much vitamin D are you already getting from sunlight, fortified milk, and your prescription supplement, before adding another source on top. And yet, doses can quietly stack from multiple directions without anyone connecting the dots. This stacking effect is where real danger tends to hide. Vitamin D, for example, is essential, genuinely vital for calcium absorption, immune function, and reducing fall risk in seniors. Most experts agree on its importance. But in excess, it can raise calcium levels in the blood to dangerous heights, a condition called hypercalcemia, which can cause confusion, irregular heartbeat, and kidney strain. The line between protective and harmful isn't measured in good intentions, it's measured in milligrams. Then there's the interaction problem, something many people never even consider. Multivitamins don't exist in isolation. Vitamin K, found in many multivitamin formulas, can interfere with blood-thinning medications like warfarin, a drug taken by millions of seniors to prevent strokes and blood clots. Taking a vitamin meant to support health could, in this case, undo the very protection a life-saving medication is providing. This is the part that should make us pause, not in panic, but in reflection. We tend to imagine harm as something violent, sudden, visible. A dramatic collapse. An emergency room. But in the body of an aging person, harm often looks like none of that. It looks like persistent fatigue mistaken for just old age. It looks like mild confusion blamed on memory naturally fading. It looks like a slow erosion of well-being that no one traces back to a daily multivitamin, because why would they? It's just a vitamin. It's supposed to help. Experts aren't saying seniors should panic and throw away every supplement bottle in the house. That's not the message at all. What they are saying, consistently, calmly, but firmly, is that personalized guidance matters more with age, not less. A blood test can reveal actual deficiencies instead of guesses. A pharmacist or doctor can check for interactions most people would never think to ask about. And sometimes, the most surprising advice from a physician is simply, you may not need that supplement at all. Your diet might already be giving you what you need. Picture an elderly father sitting at his kitchen table, lining up his morning pills like soldiers, heart medication, blood pressure tablets, and right beside them, a multivitamin he's taken for 15 years without ever questioning it. He trusts it. He associates it with care, with discipline, with doing the right thing for his health. No one ever told him to ask whether it still belongs there. No one ever told him that more vitamins doesn't always mean more protection. That's the quiet tragedy experts are trying to interrupt, not through alarm, but through conversation. A simple visit to a doctor or pharmacist, a basic blood panel, a 5-minute review of what's actually inside that bottle compared to what the body genuinely needs. It sounds almost too simple to matter. But in geriatric medicine, these small checks often prevent the very real, very avoidable harm of nutrient overload, drug interaction, or organ strain that builds silently over years. There's something deeply human in all of this. We want to believe that caring for someone we love means giving them more vitamins, more supplements, more, just in case, protection. But real care, the kind backed by science, often looks different. It looks like asking questions instead of assuming answers. It looks like personalizing health instead of generalizing it. It looks like trusting evidence over packaging, and conversations over convenience. So if there's one truth worth carrying away from this, it's this: aging bodies don't need more of everything, they need exactly what they're missing, in the right amount, at the right time, under the right guidance. Multivitamins aren't villains. But they aren't universally safe either. The difference between healing and harm often comes down to something as simple as a conversation with a doctor that never happened, until now. If this made you pause and think about a parent, a grandparent, or even your own future self lining up pills on a kitchen table, that's exactly the kind of awareness worth sharing. Like this video if it gave you something to think about, drop a comment telling us which part surprised you the most, and share it with someone whose health might depend on knowing this today.